This paper reports on a fairly new special test called the arm squeeze test from 2013 by Gumina et al. The arm squeeze test is done exactly how it sounds. Here's a picture of it. The idea is that you squeeze the middle third of the arm to distinguish between neck and shoulder pain. So I'm going to use this paper by Greenhalgh just to keep me on track when I'm going through the other one. They invite me to ask first, is the test potentially relevant to my practice? Well, yeah, clearly it is. Something we have to do most days is differentiate between neck and shoulder pain. And the way this test does this, the hypothesis of it is pretty feasible. The idea is that the musculocutaneous nerve, the radial nerve, and the ulnar nerve all pass through the arm most superficially in that middle third. So if you squeeze that middle third, then that's going to elicit any pain that is of a cervical origin. And people who have shoulder pain of a shoulder origin, aren't going to find that particular test painful. So Greenhalgh now says that we need to see if this test is being compared to a true gold standard. Well, to identify people that genuinely do have pain of a cervical origin, they use clinical examination, X-rays and MRI. And for people with pain of a shoulder origin, they use the same sort of thing, examination and imaging. So without going into the kind of limitations of imaging and that sort of thing, I think they've done the best they can to use a gold standard. It's certainly not obvious that they've kind of used a crap one, so we can continue. Greenhalgh now says you need to check if this study included an appropriate spectrum of subjects. So the main thing kind of to note here is that the subjects are between 40 and 66 years old. So that means that the results of this test are only really generalizable to other people in this age. And here's the exclusion criteria, which are fairly understandable. People with shoulder instability, rheumatoid arthritis, that kind of thing. So when they were testing the arm squeeze test, did they avoid something called workup bias? So that just means, did everyone who got the new diagnostic test, the arm squeeze test, also get the gold standard and vice versa? And yes, they did, so we can just tick that and move on. And has the expectation bias been avoided? So this just means that did the people who were assessing the arm squeeze test, especially considering they wanted the arm squeeze test to succeed, they've made up this test, did they know whether the person they were assessing had pain of a cervical origin or a shoulder origin as they were doing the test? Because that's going to bias how they interpret the results of the test. Essentially, you're asking, are the assessors blinded? And yes, the authors report that they were. Although there are little things that kind of make you think, like, for example, some patients were recruited from the orthopedic spine ambulatory, which if this guy knows that that's where this woman has come from, then probably he's got a pretty good idea that she has pain of a neck origin. There's other little sources of bias in here, like they don't say how much time elapsed between the gold standard and being given the arm squeeze test. So if they're using MRIs that are, say, 2 years old as a gold standard, that's going to kind of introduce bias as well. So a few sources of bias, but we can move on to question 6, and is the test reproducible? Yeah, it is. It's just squeezing an arm, and the authors give quite a lot of nice information about how hard to squeeze it exactly on a dynamometer, that sort of thing. And now we can kind of move on to the interesting thing, which is what were the results of this investigation. So straight away, the thing you notice is a lot of 9s and 8s. 0.8 is often considered the cut-off point for usefulness of a special test. Let's go through kind of one by one. Sensitivity. So of all the people who had pain of a true neck origin, how many of them got a positive result? 96%. That's great. Of all the people who had pain of a shoulder origin, how many of them got a negative result on the arm squeeze test? 96%, so good specificity for the arm squeeze test as well. That's kind of screening stuff. Positive prognostic value is something different. You've just given the test, you've got a positive result. What does that actually mean? Well, there's 95% chance that that positive result is a true positive, which is great. And conversely, if you've got a negative result, there's 99% chance that it's a true negative. This is not neck pain, it's a shoulder pain. So these are really great numbers. We can move on to kind of Greenhall's next question, which is, are confidence intervals given? And yes, they are. You can see them here, and they're not too kind of wide either, and they don't overlap that 0.8. Has a sensible normal range been derived? Well, I mentioned before that a positive arm squeeze test is pain. But pain's obviously very subjective. How much pain? Well, the authors set pain of greater than 3 out of 10 as a positive test. So they've set a nice, sensible, fairly easily identified normal range. And in fact, most people who got true positives, let's have a look, actually got almost basically 8 out of 10 on a visual analog scale. So they were way over that 3. And has the test been placed in the context of other potential tests? So yeah, the authors aren't pretending this is kind of the be-all and end-all. They say that obviously you need to place it in the subjective exam, other tests like the upper limb tension tests, cervical rotation, active range of motion, and Sperling's test, really important for building up a full picture. So there you go, really good numbers for the arm squeeze test. Just to end on like a note of caution, there was some bias involved there, and especially important to say that I think it was my impression that a lot of special tests start off with these really good numbers, and then as people try to replicate them over time, often those numbers go down. So you'd expect this, or it almost certainly would happen with the arm squeeze test as you try to continue to assess its properties. Nevertheless, especially considering such a low cost to such a potentially high benefit from this test, is a really interesting thing to consider involving, along with these other things, in a clinical examination.